I was that girl, 19 years old, pregnant with twins, terrified. But my story did not end on that bench. It began there. When I became pregnant at 19, I had so many questions and no one to ask. The shame, the silence, the confusion, these were my companions. But I made a promise to myself, if I survived this, if I could become something more, I would make sure no young person ever felt that alone again. I was trained as a midwife, a social worker, and a public health specialist. Every qualification was a tool I was collecting to build something that did not exist when I needed it most. In December 2023, Musawo Care and Research Center opened its doors, not as a building, but as a promise. A promise that every young person who walks through our doors will walk out with knowledge, with confidence, with hope.
Uganda is a nation of young people. More than half of the population is under 18. They are the country's greatest asset and its greatest responsibility.
The silence is the problem. In many homes, talking about sexuality is forbidden. In many schools, there is no one trained to have these conversations. Young people are left to learn from friends, from the internet, and from painful mistakes.
What we see in our work is young people facing enormous burdens, anxiety, shame, confusion. They don't just need information. They need someone to listen to and to tell them that they matter.
We asked ourselves, what would it take to reach young people? The answer was clear. We couldn't do it alone. We needed midwives for the clinical knowledge. Then we needed teachers for educational approach. We also needed psychologists for the emotional support. Together, the three of us, we could offer what no profession could provide alone. We go where young people are. Holiday workshops at our center. We visit schools during term time. Community outreach in villages. We are building a network, not just of service, but of trust.
But numbers tell only part of the story. The true measure of impact is written in the lives transformed.
And so at that stage, that's when a lot of guidance and support is needed for them to be able to go through that stage and transition into adults without an identity crisis. So what we are trying to handle here is to manage so that we don't get adults with identity crisis. So adults with identity crisis are usually people you will find in offices. They have jobs, but they don't know what they are doing, okay?
Before the workshop, I was afraid of so many things. Afraid to ask questions, afraid of my own body, afraid of the future. Now I have knowledge. I know my rights, and now I know I have a future worth planning for.
My name is Iwanda Given John. I study at Namiyango College. I understood myself better in a way that I can actually open myself up for my parents and explain to them the difficulties that I'm facing. I can sit down and think of what I should tell them before I go to tell them.
The speakers didn't judge us. They listened. They understood. For the first time, someone talked to me like my future mattered. They told me about saving money, about avoiding risky situations, about believing in myself. That changed everything.
As a mother, I didn't know how to talk to my daughter about these things. It was too difficult, too embarrassing. When she came home from the Shaping Futures workshop, she talked to me. For the first time, we could speak openly. Musawo Care and Research Center didn't just help my daughter, they helped our whole family.
Since partnering with MBCRC, we've seen a change in our students. They are more confident, they make better decisions, they support each other. The Shaping Futures program has become essential to what we do.
We've proven the model works. 2,000 young people just in over a year. Imagine what we could do with more resources, more partners, more reach. Every district in Uganda has teenagers who need what we offer. Every one of them deserves the chance we've given to a young person in Wakiso.
In June 2026, MBCRC will present its groundbreaking work to the 34th International Confederation of Midwives Triennial Congress in Lisbon, Portugal, sharing Uganda's story with over 4,000 health professionals from more than 100 countries.
I was once a teenage mother with no one to turn to. Today, I lead an organization that has reached thousands, but we are just getting started. If you believe that a young person deserves knowledge, support, and hope for their future, then we invite you to join us. Together, we can shape futures. Together, we can transform lives.